Hello there and happy Wednesday. My name is Julie Hirschberg. I am a neurologic PT, the owner and founder of Reactive Therapy and Wellness here in the Los Angeles area. And so excited to join you on a Wednesday afternoon at the end of my day here to talk about what we've been learning and doing here at Reactive. We learn so much, and I want to say so much of what I learn is from the patients that I talk to, the people that I see, and particularly the topic tonight really came up in an email. And it leads to me to one of my soapboxes for sure, and that is about functional neurologic disorders. So let me kind of set the stage a little bit because I want to talk about the labeling of a functional neurologic disorder, and particularly what I feel is becoming the mislabeling of it as a non-organic disorder. Right. So this is something I feel pretty passionate about, and I think is one of the misconceptions of functional neurologic disorders. So let's talk a little bit about the history of this. Now, first of all, yes, this is my soapbox, and I get pretty heated about the words that people use because I think they're really important and they can have a lot of impact on people. But I want to go right out there and say it. Back in the day when I learned about different disorders in school, I learned conversion disorder, I learned psychogenic, and I certainly learned that there were non-organic things or signs. And so, you know, if you're one of the folks like myself who've used this language, like I've used it, okay, and now I know better. And so I'm definitely not saying this to have somebody beat themselves up and going, oh, I've been using that language, yikes. But to really have you think about the language that you are using, particularly to talk about functional neurologic disorders. So that's my disclaimer. And honestly, back in the day, so I was in school over 20 years ago, that was all we knew. We didn't know better. There wasn't a lot of research behind this to help us understand what's going on in the brain. I'm just noticing a note that says somebody's having trouble streaming this. If there's anybody else here that's live, if you can let me know if the video is off or the sound is off, that would be super helpful. I know in the past I hit a button on accident and my sound went off. If there's anybody else here that can let me know, that would be super helpful because I want you all to be able to see this. Okay. Thank you, Ellie says, all good so far. Thank you. So let's, okay, thank you, Amy. Good on my end. Okay, thank you. You know, sometimes maybe I don't have a great connection. So thank you all for commenting on that. So I first want to note the term organic, right? This term has been used in the medical literature, in the medical world, in healthcare forever, right? I actually didn't go back and do kind of a thesis on the whole history of this by any means, but it's been used for a very long time to denote something that has we can biologically test it, right? So there's a blood test we can do, there's imaging that we can do, there's electrophysiologic studies that we can do, there's something that comes up on a lumbar puncture. This word organic has been used to denote that for a long time, and that's been very helpful. Like there's a test I can do to show exactly what this is. And then the term non-organic or not organic was for everything else. And actually things like migraine, for example, were once in that category of non-organic. And I use the term, I tell you about migraine because our understanding has just oh my gosh, exponentially exploded in the last 20, 30 years of our understanding of migraine. It's not considered non-organic anymore. We understand some of the mechanisms behind that now. which is really important. And that is where functional neurologic disorders lie. Things have changed. It's not 20 years ago anymore, and we understand some of the underlying pieces that are organic, that are changes in the brain. And so this is where I think it's time for us to avoid that faulty, is it organic or is it not, a demarcation between the two disorders. And Ellie, great point here, because I think this is also really common. Ellie makes the point, non-organic in medicine equals we don't understand yet. Such a good point. And this is, you might also, there's many terms that have been thrown around for this. So medically unexplained symptoms. We don't understand. And so that was the case with migraine many years ago. That is the case with functional neurologic disorders many years ago. And that is changing. So I want to, I'm not just here to give my opinion on this. I want to bring some evidence. So of course, I've got some pieces here. So several pieces that have just come out in the last year that really intrigued me. One was this article that came out in April, the association between brain metabolism and clinical course in motor functional neurologic disorders. So in this one, they use PET scans to look at brain metabolism in functional neurologic disorders, specifically motor FND. And they also, this was like new onset of FND. And they looked at PET scans and looked at different kind of signatures and what they call them, I want to get this word right, state markers. So they were looking kind of for markers that might be associated particularly with the motor disability and a motor functional neurologic disorders. And basically their findings suggested that there might be metabolic state markers that correlate. So remember, a lot of we're in early stages of this. Correlation does not equal cause, right? And we don't know chicken or egg for some of these things, right? But there's brain markers that appear to be associated with motor functional neurologic disorders, and even more important, with recovery in motor functional neurologic disorders. So very interesting. And again, as many of the authors state in these studies, this is the start of us really understanding what might be happening in the brain for different types of functional neurologic disorders. So that was a recent one that really struck my fancy in thinking about, what is happening in the brain. We know that this is a very real thing. So, we are way beyond going through proving that this is made up. So this has been disproven over and over. Functional neurologic disorders are not in your head. They're not made up. They're not somebody faking and simulating paralysis or simulating a tremor or faking myoclonus or faking dystonia. That is not what a functional neurologic disorder is. And there have been studies to show that brain activation patterns are very different between let's pretend to be paralyzed and what is actual functional paralysis. So that's already let's take that one off the table. It's not faking. It is absolutely real. It's not malingering and all of those other things that you might have heard before in school. So, but I want to go a whole nother level. It's not only not faking, there are actual real changes that occur in the brain. And this lovely review article from Lancet Neurology, also from this year, I've talked about it before because it's my favorite article recently. So this is Hallett 2022, Functional Neurologic Disorder, New Subtypes and Shared Mechanisms. What is so interesting here is when you look at some of the subtypes of functional neurologic disorder, like 3PD, persistent perceptual postural dizziness, like functional cognitive disorders, you can actually find similar mechanisms and similar brain areas that are implicated. And I'm going to pull up one more here. So by the way, highly recommend this article. I'll put all of the links to these articles along with this video. They all go in our newsletter every single week. So if you're not already part of our newsletter, sign up now, reactiveeducation.com if you're a healthcare provider, reactivept.com if you're a person with a neurologic disorder. Sign up. I send these out on Friday to other healthcare providers, and on Monday to people who maybe have neurologic disorders. I'll send out all these articles. So this one, highly recommend because it talks about those shared mechanisms. And I really love, I've shared this one before, but I really love this particular article. I love this. This is a review of some of the functional magnetic resonance imaging findings in functional neurologic disorders. It's from 2021. And we're doing a webinar on functional neurologic disorders or a workshop for physical therapists and occupational therapists. And I'm going to talk about this, and I'm going to talk specifically about this idea of altered sense of agency, the areas of the brain that are implicated, and what that means for treatment, by the way. So if you haven't signed up for that, definitely sign up. Somebody's asking the link to sign up for PTs and patients for the newsletter. If you go, if you actually go to our bio here, there's a link to sign up, but it's reactiveeducation.com. You can sign up for a newsletter there for PTs, and reactivept.com. You can sign up for our newsletter there for a person with a neurologic disorder. Thanks for asking. I tend to talk really fast. I'll put those links when I finish up this video as well. I'll put them in the comments. But this particular article reviewed, there's been years now of functional MRI imaging. So functional MRI imaging, it's different than your static MRI imaging that you have of the brain, and that it's looking at it during an activity, whether that's you're thinking about something, you're doing an activity. And what they found through many different studies here is alterations in connectivity in the brain. Not surprising, if you're a therapist working with somebody with functional neurologic disorders, you see that disconnect, and the person tells you exactly the disconnect. I'm trying to do this and my body won't cooperate, or my body is just moving and I can't calm it down. So we hear this is happening, but it's like our technology has caught up and can capture this. Now, I'm not saying that these are being done diagnostically. They're not. These are what they are finding, and we don't know, is it the functional neurologic disorder that is being driven by these brain changes, meaning the changes occurred and caused the functional neurologic disorder, or is having this repeated experience as a functional neurologic disorder actually causing some of these brain changes? We don't know. But lots of hypotheses out there that some of these pieces, impaired top-down control, altered sense of agency, abnormal emotional processing, it makes a lot of sense, a lot of theoretical sense that those things would pre-exist and drive the actual functional neurologic disorder. I want to point to the brain on the bottom that says structural changes. So some people have made the distinction between, organic means structural and non-organic means non-structural. And maybe that's not the case. Not enough evidence for us to totally know. Not enough evidence for us to do a brain imaging and go, there's, changes here in your hippocampus. No, we don't have enough evidence there, but people are looking at this imaging of people with functional neurologic disorders and finding structural changes. It's just not set up as a diagnostic tool yet, right? So that this was, I love this particular review. I'll put it in our newsletter again. It's at reactiveeducation.com if you're a healthcare provider, reactivept.com if you are a person with a neurologic disorder. If you're not already on our newsletter, we send it out every week with our videos, with links to articles, resources, all of that. And this is part of the workshop that we're doing in a couple of weeks here, September 13th, I want to say, for healthcare providers, all about functional neurologic disorders. So I've been diving into the literature, reading more, but definitely have found it is my passion and interest to dispel some myths. So today, the myth we have dispelled is that FND is not organic or non-organic. We know enough now that there are actual brain changes. There's a real reason for this to occur. It's not faked. It is not non-organic. It is a very real brain disorder. And it is also something that people can recover and improve from with therapy. Now, somebody asked a question, and I'm just looking back. Would you call vestibular migraines organic? Yes, I would. We know enough about migraines now and the pathophysiology that occurs to know that they are organic. And honestly, I think maybe I veer on the side of just because we can't explain things doesn't mean they're non-organic. So I don't just kind of shrug my shoulders and go, well, it's medically unexplained, it's non-organic, it's psychogenic. I just don't think that's really appropriate. I think we just don't know for some things. But for functional neurologic disorders, for vestibular migraine, for other types of migraine, we do know. We do know that there is actual changes. And this is coming for many disorders that we see at Reactive, things like connective tissue disorders that people didn't understand before. Things like POTS, or postural orthostatic tachycardic syndrome, that people didn't understand anymore. These are real organic things happening. And I think so this will be my last piece of the soapbox, I promise. One of the things that we do in, especially in Western medicine, is we artificially separate biologic and psychologic and social and environmental issues, and it's totally arbitrary and artificial. The brain, for one, and you know, I'm a lover of the brain, right? I have brains all over the place here. I love the brain. Yes, the brain has key centers for motor information, for sensory information, and so on, but it is so heavily interconnected that we can't really piece apart a pure part of the brain that doesn't have neurons connecting from many, many other areas. And I think that is the artificial line that we've drawn because it helps us understand, well, like emotions are over here and that's psychological, and motor stuff is over here and that's like motor and that's organic. No, like yes, we have those areas, but they're so interconnected. It's really, truly artificial to be separating those. And I think that's one of the issues with the organic, non-organic, is it's an artificial separation, and it's we know so much more now. We know that our brain and body aren't kind of these like separate entities functioning on their own, so heavily interconnected. And that's what drives our understanding and then our treatment of some of these most complex disorders. And I say they're complex because we're still trying to understand them. And I think that is, our understanding's growing and growing every day. So that's also why I love this stuff, is I'm curious and I'm always wanting to understand more. So as you know, I'm hopping on here every week to chat about what got curious about and I'm reading about. So thank you for joining me in that journey. It really is like a true love of mine to get curious about our nervous system. So thank you for that. Please reach out if you have questions. I know I think I got to our questions today, but if you've got questions, send me a message, put them in here as we're chatting. I am going to go live on our Facebook page on Friday and talk about an article I've just been obsessing over for like 2 months. And by obsessing, I mean reading it over and over to try to understand it. And I still don't fully understand it, but I was like, I'm going to chat about it anyway because it's so interesting. Also on functional neurologic disorders, but on the role of the predictive brain. So join me on our Facebook page Friday, 12:30. I'll be chatting about that. And again, this will all be on our newsletter that's coming out this Friday and Monday that you can catch at reactiveeducation.com or reactivept.com. I'll send this all out to you. And again, if you're a healthcare provider, we're doing a free workshop in a couple of weeks on functional neurologic disorders because it's basically our mission that every patient has access to really well-informed care for this disorder, no matter where you are in the world. So we're just spreading the word. Sign up for that workshop. That's also, you can sign up at reactiveeducation.com, and I will see you there. Thanks so much and have a great night.